Welcome back to the deep dive. Today we're jumping into a topic that so many of you have asked about, something that's incredibly common but also really misunderstood: sensitive skin.
It really is that feeling of, constant discomfort, that anxiety that every new product you try might be a disaster.
Exactly. And the scale of this is, well, it's staggering. Our sources say it affects nearly half of us. We're talking 50% of women and 40% of men are prone to it.
Which is huge.
Yeah.
And it's why we need to be clear on what it actually is.
Right. So let's get that definition down first. The sources are really clear on this. Sensitive skin is basically a heightened reactivity to things on the outside.
Mhm.
It causes those feelings we all know: stinging, tingling, burning, that awful tightness. But, and this is the key part, it's not a medical condition.
No, it's an issue of function, not a disease.
Mhm.
And to get a handle on that function, you have to look, well, deeper than the symptom.
Like they're the surface.
Exactly. The real root of the problem, and this came up again and again in the materials, is a weakened skin barrier. So our goal today is to give you the tools to understand why your barrier might be weakened.
From your genes to your cleanser.
Right. And then give you clear, actionable steps to start rebuilding it.
Okay, so let's unpack that. If it's so common, how do you know if you have, like, true sensitive skin versus just a one-off bad reaction? What should you be looking for?
Well, the symptoms are pretty consistent, and they tend to show up in the same spots on the face.
Where are we talking?
So beyond the obvious redness or stinging, the most reactive zones are usually the forehead, the chin, the cheeks, and specifically that upper cheekbone area, the malar eminence.
Ah, okay.
And crucially, the nasolabial fold, that area around your mouth and nose that moves so much.
That makes so much sense. I mean, those are the areas we touch the most, the parts that get hit by wind and food and everything else. It's a huge clue.
It is, and it leads right to that question everyone asks when a new cream starts to burn.
Why is my skin so sensitive all of a sudden?
Yeah, and the thing is, it's almost never all of a sudden. It's usually a buildup. Your sources actually laid out a great little self-assessment checklist you can run through.
Okay, walk us through it. What are the big things to watch for?
It's all about looking for patterns. First, do you regularly see redness or flushing, say, after being out in the cold or when you're stressed? That's the visual cue.
Got it.
Second is tactile feedback. Do you notice itching or irritation after you touch certain things, like detergents or maybe even certain fabrics?
So it's not just about your face. It's how your whole body is reacting to your environment.
Absolutely. Then points 3 and 4 are about the physical feeling. Third, do you often feel dry and tight? That rough, flaky feeling, that's moisture escaping. And fourth, do you get that immediate prickling or burning when you put on a new product?
Oh, that immediate sting is the worst. What about when it takes a few days to show up?
That's point 5, and it's why you have to be careful. The sources really emphasize patch testing.
Yeah.
You have to put a tiny bit of a new product, say, behind your ear, and just leave it for 48 to 72 hours. If you skip that, you're just playing roulette with your face.
It's so simple, and we should all be doing it, sensitive or not. Okay, what are the last steps?
The last few are more observational. So point 6, look at your skin right after you wash it. If it's red or tight after just using lukewarm water, that's a big sign. And then 7 is starting to really recognize your own personal triggers.
Identifying the what and where to get some control back. And of course, the last step is always, if things are really bad, see a dermatologist.
Absolutely crucial. But this brings us to the really frustrating part, the why. Why are some people's barriers so weak to begin with?
This is where it gets super interesting. The causes are all over the map. Let's start with that fundamental flaw you mentioned, the dysfunctional barrier. Give us that analogy you used.
Okay, think of your skin barrier as a brick wall. Your skin cells are the bricks.
Right.
And the lipids, the natural fats and oils, are the mortar holding it all together. In sensitive skin, that mortar is basically crumbling.
So if the mortar's crumbling, what happens?
2 things go wrong immediately. First, irritants and allergens can get in through the cracks. And second, all that important moisture leaks out, and the sources are clear. Things like over-cleansing or using those really harsh, foamy soaps are a primary way we dissolve our own mortar.
We're literally washing away our own protection just to feel squeaky clean. But what if it's genetic? How much can you really change then?
Genetics is a huge piece of the puzzle. If conditions like eczema, rosacea, or psoriasis run in your family, You're just predisposed to a weaker barrier. And yeah, the sources do note that people with fair skin can be more prone to it simply because their skin is often structurally thinner.
So for some of us, it means we have to be even more careful about everything else. What about the environmental enemies?
Everything. The air you breathe, the weather, extreme cold that sucks out moisture, or hot, humid air that causes irritation. Then you have direct physical attacks.
Like the sun.
Sun exposure, windburn, pollution particles, airborne allergens, they all damage that protective layer. We really underestimate how much just walking around a city can degrade the barrier over time.
And then there are the internal factors we can't control, like age and hormones.
Definitely. Hormonal shifts are a massive trigger. Think about
Hmm.
puberty, pregnancy, menopause. All those fluctuations can just ramp up skin reactivity.
Hmm.
And as we age, skin naturally thins, lipid production slows, and the whole system just becomes less resilient.
Okay, so let's get to the things we can control, our lifestyle. The sources were very direct about irritating products, especially over exfoliating.
Oh, absolutely. Our culture is obsessed with exfoliating. But for sensitive skin, using harsh scrubs or acids is like taking a power washer to that already crumbling brick wall. You're just actively blasting away what little mortar you have left.
And then lifestyle just piles on top of that. Stress, not sleeping enough.
They're not just in your head, they show up on your face. Chronic stress releases cortisol, which fuels inflammation. A poor diet does the same thing. Sugar, alcohol, even spicy foods for some people can cause that internal fluffing that you see right on your skin.
And one last thing that's often overlooked, medications.
Yes, we have to remember that. Certain medications, like strong acne treatments or even things like chemotherapy, can seriously dry out the skin and just send sensitivity through the roof.
So if we connect all these dots, it's clear that unmanaged sensitivity can be a real slippery slope. It's like the smoke before the fire for more serious conditions.
That is the critical insight here. Sensitivity doesn't happen in a vacuum. It can be the first sign of something else going on. The sources pointed to 4 major conditions that often overlap with it.
Okay, let's go through them.
First, you've got eczema or atopic dermatitis. That's that chronic, intense dryness and itching. Then there's rosacea, which is more about the persistent facial redness, the visible blood vessels, and reacting to things like heat or spicy food.
That's a really important distinction. Rosacea isn't just blushing.
Not at all. Third is contact dermatitis, which is a direct reaction to something touching your skin, whether it's an irritant like a harsh soap or an allergen like nickel. And fourth, and maybe the most severe, is psoriasis, which is an autoimmune issue causing those thick, scaly patches.
So when does this stop being just uncomfortable and start becoming a real risk? What happens if you just let it go?
The complications can be pretty significant. Your risk of allergic reactions to things just skyrockets. But much more seriously, your risk of skin infections goes way up.
Because the barrier is broken.
Exactly. The skin is cracked or weeping, and that's an open door for bacteria. And that explains why the skin can literally hurt to the touch. It's not just a feeling anymore. There's real damage. We're talking intense inflammation, blistering or oozing, even bleeding cracks.
And we can't forget the psychological side of this.
I can't. The sources were very clear on this. Having visible chronic symptoms can lead to real anxiety, low self-esteem. It has a measurable impact on your quality of life.
Given how serious it can get, a proper diagnosis is key. It starts with your history, right?
Yes, a dermatologist will want the whole timeline. Your symptoms, your triggers, the products you've used. Then they'll do an exam. But to get to the root cause, they might need tests like patch testing to find specific allergies or even a skin biopsy to rule out other diseases.
So the bottom line is, if you're seeing open sores or are in real pain, don't wait.
Don't wait. But now, let's shift to the good news. Management. Because even if your sensitivity is genetic, you can't prevent it, but you can absolutely manage it effectively.
Okay, let's get into the solutions. The sensitive skin toolkit. First up, the routine. And consistency is the hard part, right? How long do you need to stick with something?
This is so important. The sources stress you have to commit to a gentle, barrier-focused routine for a minimum of 4 months to really know if it's working.
4 months? Okay, that's a marathon, not a sprint. So let's break down the pillars of that routine. Pillar 1, cleansing.
Twice a day, morning and night. Use a gentle, non-stripping cleanser, like a cream or micellar water, and this is key. Use lukewarm water only. Hot water melts that lipid mortar right off your skin.
Pillar 2, toning. Is this necessary?
It's optional, really, and if you do it, it has to be alcohol-free. The goal is to balance pH, so things like pure rose water or calendula water are great, gentle options.
Okay, pillar 3, moisturizing. This is where we start rebuilding that wall.
This is the foundation of repair. Your moisturizer must be hypoallergenic, non-comedogenic, and fragrance-free. But more than that, you need to look for specific ingredients. The building blocks.
What are they?
Focus on ceramides. They are the actual mortar physically patching the barrier, and hyaluronic acid, which is like a sponge that pulls moisture deep into the skin.
Let's pause on those two for a second. Why are those two so much better than, say, just a random facial oil?
Because they directly fix the two main problems. Ceramides are lipids that are already in your skin. So by adding more, you are literally plugging the holes in your brick wall. Hyaluronic acid fixes the dehydration that results from that leaky barrier. When skin is full of water, it's less inflamed and just works better.
That makes perfect sense. Okay, and the final, non-negotiable pillar, protection.
Every single day. Sun protection. Sensitive skin is so vulnerable to UV damage. You want a broad-spectrum mineral or hybrid sunscreen, SPF 30 or higher, and look for a PA+++ rating.
What does that PA++ actually mean?
SPF measures protection against UVB rays, the ones that burn you. The PA rating measures protection against UVA rays.
The aging rays.
Exactly, the ones that go deeper and cause long-term damage and sensitivity. PA+++ is a high rating, so it tells you the sunscreen is serious about protecting you from that deep structural damage.
That is so useful. Okay, so we know the building blocks. What about when you're having a flare-up? What ingredients help calm things down?
You want anti-inflammatories. Look for aloe vera for that immediate soothing feeling, chamomile to reduce redness, and oatmeal is a proven anti-inflammatory. Then you add barrier supporters like shea butter and antioxidants from green tea.
And what do we run away from? The barrier strippers.
Alcohol, sulfates, those things that make cleansers super foamy, artificial fragrances, just simplify, simplify, simplify.
Let's move beyond the bottle to internal health, diet.
Diet is all about managing inflammation from the inside. So you want to increase your intake of omega-3s, think salmon, walnuts, flax seeds, and antioxidant-rich foods like berries and leafy greens.
And what do we cut back on?
Lemon processed foods, sugary stuff, alcohol and caffeine, as they can all cause flushing and inflammation. The sources also say to monitor your dairy intake, as it can be a trigger for some.
You mentioned the difference between dry and dehydrated skin earlier. Why is that so important here?
It's critical because they need different solutions. Dry skin lacks oil, so you fix that with lipids, like ceramides. Dehydrated skin lacks water, which makes the barrier fragile and prone to irritation. You fix that with water, both inside your body and on your skin, with hyaluronic acid. Hydration is the engine for your skin's defenses.
And lastly, something we forget, our clothes. Friction is a huge trigger. What fabrics should we be looking for?
Soft, breathable fabrics are your best friend. So, cotton, silk, linen, bamboo. And for cold weather, surprisingly, a soft merino wool is great because it manages moisture without being scratchy like regular wool.
So what does this all mean? When we put it all together, what's the big takeaway?
The takeaway is that managing sensitive skin is about a consistent three-pronged strategy. You need radical simplification in your products, absolute commitment to environmental protection, and a real focus on internal health through diet and stress management. It's about being your own detective. Find your triggers. Rebuild that wall with the right ingredients and patch test everything. The reward is a huge improvement in your quality of life.
I think that framework simplify, rebuild, protect is the clearest way to think about it. And for a final thought for you to take away. The source material mentions that the chronic itching from sensitive skin doesn't just feel bad, it actively disrupts your sleep, which creates a cycle of stress and inflammation that makes your skin even worse. So, considering that stress and lack of sleep are huge triggers, ask yourself this. How might managing your stress through meditation, yoga, or even just better sleep habits not only help you feel better, but also fundamentally break that cycle of irritation? What's one small stress-reducing step you can take today to start supporting your skin from the inside out?